Good afternoon, my name's Joanne Dwyer. This is my presentation for practice management. My student number is 00040457T. I apologise for the way this is filmed. I unfortunately don't have anyone that could help me, and I'm really keen to get this finalised. So let's get started. Before I begin my presentation, which includes a slideshow, I'd like to summarise my research, which is also detailed more thoroughly in the references section. In order to compile this presentation, I attended a Metagenics seminar in February this year on the topic of point-of-care screening. I've completed many hours of online research and utilised several books, and I also interviewed a professional colleague who I respect immensely about this issue. The topic that I've chosen is pathology tests and their value within the complementary and alternative medicine sector. This is an area particularly relevant to all areas of natural health and health in general, given that the allopathic ranges reflect what is common instead of what is actually optimal and healthy. According to the laboratory evaluations for integrative and functional medicine, in Canada, the normal range for a parameter is defined as the values at the extreme of two standard deviations from 95% of the worldwide population, which cannot possibly take into account one individual's particular set of health circumstances. Something very important to mention, though, is the faith that people and the general public place in blood tests, as they've been a trusted diagnostic tool in medicine for such a long time. The reference ranges which are used in complementary medicine are much more conservative, and there are many excellent books on the subject to use as a specific reference point. Now I'm going to go over to my slideshow, which just has some examples of references, both allopathic and complementary. So let's get started. I hope that you can see this clearly, but I'm going to submit it with my video anyway. So this just details my research. So as I've already said, I attended the Metagenics seminar. I interviewed a colleague who's a Master of Acupuncture and also a Master of Women's Reproductive Health. I researched many online resources, and I extensively utilised the visual textbook of nutritional medicine. This is a table about successfully interpreting lipid profiles. It just details, so on the the left column rather, we have the total cholesterol, the measurements, so the ideal range, the normal range, borderline high risk range, and high risk, and then I've put in an example patient's results. Unfortunately, this patient would have been told that they were just in the high risk area, and unfortunately they should be much more towards this end of the scale. As you can see here, the normal range is actually quite significantly higher than the ideal range, which is where we should really encourage people to sit if they want to be optimally healthy. So I think this is a really good example of one of the biggest problems that arises in health today, particularly allopathic medicine. So what is the key to successfully interpreting blood test results? I asked my colleague Julie Simpson, who's the principal acupuncturist and women's health specialist at her practice, Awakening Therapies in Cairns. And her answer was, there are many factors to consider when looking at results. She said in order to establish the correct interpretation, you need to look for patterns in the results and determine why these symptoms are occurring and what the underlying cause is. She went on to say, I always practice based on the principles of diagnostic orthomolecular medicine, which states that there is no one singular test that can define a problem. Sorry about this filming. All things must be considered: the symptoms, examination, blood tissue, and sometimes even urine, also to complete the picture and work it out definitively. The DOM sequence is logical and follows this sequence. Interpret the symptoms biochemically. What links these symptoms? What is the process driving this? What compensatory mechanisms have failed? In what order should the treatment be carried out? This sequence guarantees a successful outcome. So why are so many people consistently going to see a general practitioner feeling unwell, having a full battery of blood tests done, eagerly awaiting the results to find a solution to their health woes, only to discover that according to their GP, they are healthy and everything is fine? The main problem with this lies in the irrefutable fact that symptoms do not lie, and as such should not be ignored. The result of blood tests alone can only be one piece of the puzzle, and if a person is not feeling well, all areas should be investigated as early as possible. There are many excellent point-of-care diagnostic tools available to CAM practitioners. It simply is not necessary to rely on pathology testing, even in complex cases, although as I've stated above, it can be an essential tool in some cases, as testing is quite accurate and reliable, but it's always open to the interpretation of the tests. It is my opinion that the Western world's current health epidemics of allergies, obesity, cancer, and mystery autoimmune conditions could benefit greatly from the integration of complementary and allopathic medicine. If the diagnostic principles of orthomolecular medicine are used, practitioners can be confident in creating a successful treatment plan and, most importantly, a positive outcome for the patient. Thank you for taking the time to watch my presentation. Again, I apologize for the quality of the filming. I hope that you can see everything, but as I said, I'm going to submit the little slideshow that I made, and hopefully that will be all that you need. Thanks so much.